Hi everybody, Dr. Michael Nusbaum here.
Dr. Daria Klachko, Totten.
And welcome to
HealthTalks.
All right, so today we're going to talk about semaglutides, Ozempic, Wegovy, Mounjaro.
Very popular right now.
Yep, and what are the differences between them? Yeah. So you've heard of Ozempic, right?
Of course I have. Of course I have, but I kind of want to hear from you of how they work.
Yeah, well, Ozempic is not a weight loss medication. It's not FDA approved for weight loss. You're not going to really lose a lot of weight on Ozempic. So please don't do Ozempic for weight loss. The two medications that are approved for FDA approved for weight loss are Wegovy and Mounjaro. Wegovy is semaglutide and Mounjaro is tirzepatide. And the differences between the two are semaglutide, Wegovy, is a GLP-1 agonist, whereas Mounjaro, tirzepatide, is a GLP-1 and a GIP agonist.
So what's the difference?
Yeah. So basically what you need to know is a GLP-1 agonist does a couple things. Number one, it works to affect your satiety so that you're just not hungry.
That's a good way to start a diet.
Exactly. Doesn't mean you should not be eating though, and that's where one of the problems comes in with, something like Ozempic, where people are just getting prescriptions for Ozempic and they're not getting a diet along with it. They're not seeing a registered dietitian. Right. So what's happening, if you've heard of Ozempic face or Ozempic butt,
we've heard about that.
Yeah, that's because you're losing too much muscle. You could actually lose more muscle than fat with something like Ozempic if you're not getting enough protein in, and that's where a comprehensive program like we have. With registered dietitians who are going to calculate how much protein you should be taking in every day so you're losing more fat than you are muscle. Much more fat. It should be majority.
That's so important, right? We don't want to lose muscle, we want to build muscle.
Exactly. So, the Ozempic face is really losing muscle in your face. You're looking cachectic. Yeah. And you don't want that. So getting back to the two that are FDA approved, Wegovy and Mounjaro. So the three things that the semaglutide are doing: one, controlling hunger so that you're not hungry.
That works on the level of the brain, right?
Correct. Exactly. Centrally mediated.
Yep.
Two, decreases gastric emptying. So you feel full longer with a small amount of food. You're like, I'm done, can't eat anymore. And three, it regulates insulin and glucagon secretion, so you're not getting those dips. Right. In blood sugar levels. A lot of people will be doing a diet and they'll start carb craving. Right. That's not going to happen on a semaglutide because that's all smoothed out.
Right, and that's such a hard thing is when you're craving carbs.
Absolutely, 100%. The next one is tirzepatide. Tirzepatide is a GLP-1 agonist, has that too, but it also adds in the GIP. Now, GIP is actually affecting your gastrointestinal motility. So you're actually decreasing the motility not only of the stomach for the GLP-1, but now you're affecting the motility of the intestines. Yeah. So the side effects tend to be greater with tirzepatide than they are with semaglutide.
You're talking about constipation.
Yes, well, you get constipation with both, and some of the warning signs that they're talking about, they're trying to put warnings on some of these medications for bowel obstruction. That's really because you're constipated. Right. Why are you constipated? Well, that's a good question too. And basically what's happening is that whenever you are actually burning fat, your body needs a lot of water to burn the fat. So water, oil and water don't mix. Fat adds anhydrous, there's no water associated with it. So when you're actually
dehydrated.
Exactly. So when you're burning the fat, you actually need to get a lot of water in to actually help your body burn the fat. So when you're in a catabolic state and your body's burning fat, you're going to be using a lot of water to help your body do that. In fact, I've had patients come in who said, I'm drinking more than a gallon a day and I'm barely peeing that much off. Where's it all going? It's going to burn the fat. So if you're not drinking enough water, you're going to get constipated.
How much water?
That's a good question. That's where you really need to be coming in and seeing a registered dietitian, getting on a body composition machine, because they're going to tell you about your intracellular water, extracellular water, and whether you're dehydrated or not. That's going to help you adjust your water intake. So you really shouldn't be doing any of these medications on your own without medically supervised.
It's so important to be on a program because all these questions that you may have will be answered and you'll be guided through the whole process of what to do and what not to do. And like Michael said, how much protein are you supposed to take? How much water are you supposed to have? And being in a program helps that.
Absolutely. Our comprehensive weight loss program, we have patients coming in every other week.
Yeah.
and getting on the body composition machine to find out what's going on with their bodies. Because if we notice they're losing too much muscle, we have to up the protein intake. And that's where you really need to be monitored. And doing this on your own, unfortunately, is not a good idea.
And this has to be customized, right? It's customized to the person.
Absolutely,
the
absolutely, and how the body's responding.
Right.
You know, our first visit is 2 weeks after you start the medication, not to torture them, but really to try and find out what's going on with your body. If we're giving you the medications, you should be losing a certain amount of weight and not losing too much muscle, and that's where we have to adjust it. That's where the registered dietitians come in to figure out, you know, what's going on with your body and what we need to do to adjust the diet for your body.
And talking about like metabolism, like, you know, looking at the body, your body composition looks at your metabolic rate.
So that's a really good point. None of these medications do anything for slow metabolism. So I've had a lot of patients come in who are like, well, I was on Ozempic or I was on semaglutide, Wegovy, and it didn't do anything for me. And that's probably because they had a slow metabolism.
Yeah.
Maybe they're perimenopausal. I don't know, but that's very common too. But if you have a slow metabolism, none of these medications are going to speed up your metabolism. They're going to help you not feel hungry and maybe help you lose some weight.
Not eat as much, yeah.
Correct, but you really need to bring up your metabolism. And there's different ways to do that. Obviously, one is exercise, but medications like ephedrine or something like that, a stimulant, also some herbals.
We
have some herbal
the
supplements that help speed up your metabolism. So you need those things to actually speed up your metabolism in addition to taking the medications that are suppressing your appetite. And that's why a lot of patients who've tried some of these medications and were not successful, it wasn't their fault, they were doing it on their own and they weren't getting any support.
So what do you think, Michael, about exercising when you're dieting?
I think it's a great idea. You know, once again, if you are so washed out that you're not able to exercise when you're on a diet, you're not getting enough protein in. And that's something you need to be talking about with your doctor. And this is a big warning sign. If your doctor's not willing to sit down and have conversations with you and go over the diet, just they gave you the prescription, it's not the right doctor for you. You really need to be going to a medically supervised weight loss program with physicians and dietitians who specialize in that.
So you're saying that when a patient's on this program, they should have individualized custom care
100%.
That looks at how they're eating as well. So balancing the protein and the carbs and the water intake is so important on any diet, really.
Absolutely.
But especially with this one.
100%. And once again, if you're on Ozempic for weight loss, please stop. See a professional physician who specializes in medical weight loss and get on the right medication, get into a medically supervised program with a registered dietitian, and you really need to be monitored.
100%.
All right, well, I'm
Thank
Dr.
you.
Michael Nusbaum.
Dr. Daria Klachko Totten.
Thanks for joining us at Health Talks.